Achha, now I have to go for. No. That is different. I will go for you first. Starting the YouTube. Live at YouTube, na? It takes time. gmail.com. YouTube. Go live. Right? Now what to do? This one. No, this one I have to make it. No? Once I make you co-host, I will be relieved. The mouse is giving me a lot of trouble. Now? No, this is mute. I will do it.
Good morning. I think you are mute.
Yes, I was unmuted. Yes, now I am unmuted. How are you? Nice to see you.
Nice to see you too. Things are going well here. How about there?
It's a fine. And I think that it is too early in the morning to you. And around
Good morning.
Good morning.
I think you are mute.
Am I audible?
Yes, you are audible, sir.
Yes, I think my sound is a little bit delayed. Nice to see you too. Things are going well here. How about there?
Echo is fine. And echo is going on. Echo is going on.
Yes, sir. Echo is there.
Good morning.
I think you are mute.
Sir, have you started YouTube also at your place? Yes, you are audible, sir.
Yes, I think my sound is a little bit delayed.
So that is maybe because of YouTube voice is coming now.
Chinmay, that I think I have started YouTube for that reason.
Yes, sir. You stop the YouTube in your computer, sir. Yes, sir. Echo is there.
Yes. Good.
Or make it mute.
What is YouTube?
Sir,
yeah.
YouTube also at your place?
Yes, I've started. Yes. Now stop live streaming.
Maybe because of YouTube voice is coming now.
Now it is coming. Chinmay, that I think I have started YouTube for that reason.
Yes, sir. You stop the YouTube in your computer.
Yeah, I have stopped the YouTube.
Yes, sir, but still it is coming.
How to do it?
Or make it mute.
What is YouTube?
I'm not.
Sir, yeah, Chinmay, I am making you co-host, and you just manage from. Can you manage?
Yes, sir.
Yeah, I make you.
Yes, sir. Yes, sir.
Is it okay to you now?
Yes, sir. Yes, sir.
Just to see that whether you can operate the YouTube.
Let me check, sir.
Hi, Gustavo.
Dr. Gustavo join. Hello. Hello.
And good morning, my dear Kusal.
Good
It is-
morning. Good morning. Dr. Luciane is here. Dr. Luciane is
Yes,
here.
I see her. Hello, Luciane. Good to
Hi.
see you. Look at
Nice to
where
see you
I am. This is 6:30 in the morning for me. I suppose it's 7.
Yes,
Yes.
yes, very early morning. We have disturbed you and Dr. Luciane very early
Oh,
morning.
no problem. No, I have to get up early. My daughter starts school at 7, so it's okay
Okay.
for me.
Okay,
Oh,
so
wonderful.
7:30. So how is the situation, Dr. Gustavo, at in your place? Yeah.
The COVID situation
Yes.
or the life situation?
No.
Life wonderful as always. Life wonderful as always.
Right.
Look at our city at
Yes, yes.
3,600 meters, between 4,100 and 3,100, and that's Illimani, our mountain next to the city of La Paz. So
Very beautiful.
yes, very beautiful, and of course I am well known in India as the hypoxia man, and I'm actually a chronic hypoxia man. But about the COVID, the COVID is very low, very low. We are having practically completely normal lives right now.
My good.
They are
In
joining.
Brazil, you also are in a good situation. Almost 80% of the population is vaccinated.
Recording not started. We starting. the
Okay,
recording.
okay.
We have someone in the line.
Yeah, we are many people have joined, and there are you are the chairperson, Dr. Gustavo, and there are 3 panelists. Of the 3 panelists, one actually mother got a stroke in the morning. So
Oh my
she's-
God.
yeah, so that Dr. Shoudab,
Sir,
she
you
was,
have to join when I will tell you.
and so when Dr. Shoudab,
Now your screen is showing here.
hello,
Go out of screen.
Sir, somehow still echo is coming sometime.
echo is coming.
Dr. Manjunath. Dr. Lata.
Yes, sir.
Yeah, Dr. Lata has joined.
Yes, sir. Yes.
So Dr. Lata, Professor
Yes.
Physiology and Director of IQAC, BLDEDU.
But this is not, I am not
Yes,
speaking
join.
at all.
Yes, sir. Good evening, sir.
Yeah.
It
Good
seems
evening.
that something has been recorded and is
As well as
playing
Chairperson,
now.
Session Chair,
No.
Sheta.
But no, it is actually old one. No, there is some, I think the wrong, it has, what happened to the old earlier
Dr.
one?
Lata just addressed you.
How it is?
Yes, sir. Good evening, madam.
Good evening, ma'am.
I think recording started.
Yes, sir.
I think live stream started.
Yes.
Sir, also press on the record, so recording can also.
Recording, I started it. No, there is some echo is going on in the
Yes, sir.
background.
Whatever is getting recorded, it's getting once again.
Just the same repetition of the word.
If you have your computer and your phone connected, Kusal,
No,
right?
my phone is not connected.
Okay.
No, there is some echo is going on in the background.
Prachi's
Recorded. It's
laptop is connected. Prachi, Dr. Prachi's laptop.
If you have your computer and your phone connected.
No, my computer is not connected.
Okay.
Sir, I think Prachi's and your laptops are both are in same place, sir. That's why it is
No,
it's
Mom, no, Prachi, Dr. Prachi is in her chamber, her room.
okay, sir.
Okay, let us. No, my is not connected. Yeah, it is repetition.
Sir, I think Prachi's and your laptops are both are in same place, sir. That's why it is
No, Prachi's laptop is closed. Dr. Prachi is in her room.
No
I
problem.
think
Sir,
Professor Kusal will have to stay quiet.
No, yeah, duplication.
Sir,
No
please
words
make me
from
host.
Professor
Let me
Kusal.
try on my side.
No, what I'll do, I will go off and again I will start. from
Sir,
my
make
end.
me host. Make me host if possible.
I will make you host. 1 minute.
Kusal will have to
1 minute. I will make you host. Chinmoy. Make host.
Luciane, normally these meetings go on very smooth. Something of Murphy's law is involved today.
Can
Yeah.
you hear me okay?
Luciane is there. Where is Dr.
Yes, we can hear you very well, Luciane.
Okay, thank you.
No. Luciane, talk. Co-host. His co-host, no? Dr. Luciane, we made you as co-host. So you can share your screen. Playing music. Huh? How it is coming?
Beautiful music.
Huh?
My screen now?
Yes, we see it.
No, Chinmoy, this music is I am not playing, but it is coming from somewhere.
Sir, it is coming from your computer only.
Huh? My phone.
Yes, sir.
No, you don't know actually. There is some problem. Let's see.
Very nice. Do you agree, Luciane?
Okay, I can. Yeah, mungkin. Americans
Just see the black other side. Here not people. I'll go outside and outside something is there or not. Let's check the outside. It is her computer. It is her computer.
Okay, I think it's perfect. Very good. Kusal, Professor Kusal Das.
Yeah.
Okay.
Is it okay now?
Yes, sir.
Fine. So I think that we have already taken a lot of time. I apologize to all of you for there is some inconvenience to all of you, specifically the guest and today's distinguished speaker. So I apologize on behalf of the research club to all of you. And I just like to start now because it is 4 minutes past 16 for us. I think it is 4 minutes late, but we are in time approximately, so we can consider. So I request Dr. Jyoti Khodnapur. I will introduce you the two of the important person here who are the part and parcels of the research club. First is Dr. Jyoti Khodnapur, who is the coordinator of the research club. And next is the departmental chairperson, Dr. Shumangala Pati. So Dr. Shumangala Pati is professor and head of the department. She did her MD in physiology, and she is extremely good in medical education and other curricular activities. And Dr. Gustavo personally knows her very well. And Dr. Chinmoy also knows because Chinmoy is already very close to us. And I will introduce the other panelists later. And but now, after Dr. Shumangala, who is the chairperson and also who is the convener of the research club. So I like to request Dr. Jyoti Khodnapur to give a welcome address to all the guests. Over to Dr. Jyoti.
Thank you so much, sir. I welcome you all for the 50th Research Club meet, that is Golden Jubilee celebration. So I'm very honored to welcome Dr. Luciane Gargiogloni, Associate Professor, Department of D. Morphologia, Sao Paulo, Brazil. I welcome you, ma'am, for 50th Research Club meet. I welcome Chairperson, Professor Gustavo Zubeta Caliza, Professor and Head, High Altitude Pulmonary and Pathology Institute, La Paz, Bolivia. I also welcome today's panelists, Dr. Chinmay Shah, Professor and Head, Department of Physiology, GMC Bhavnagar, Gujarat, and Dr. Srilakshmi Bagli, Associate Professor, BLDEDU, deemed to be University. I welcome all faculty members for today's 50th Research Club. Once again, I welcome you. Thank you so much. Now I request Professor Kusal K. Das sir to proceed.
Thank you, Dr. Jyoti. It is a really great honor for the Research Club 50th Research Club of Department of Physiology. This Research Club established in 2017, January. We could have actually completed 50 at least five months back. Due to the COVID-19, we are unable to conduct some of the meeting even in online because situation was very tense and others. So we have missed around 5 to 6 Research Club meeting, around 5 Research Club meeting. And we usually invite the distinguished professors, scientists from each branch and each discipline of the life, not only physiology, but also from the other branch disciplines of the medicine. Besides, we invite the environmentalist, we invite the scientists of other disciplines like chemistry, nanomedicines, nanosciences, physics, and many other disciplines. And we also invited earlier the bird watcher, photographer, camera, sociologist, and literature. In fact, the last Research Club meeting, we invited a poet and writer. So this is actually promoting the multidisciplinary culture. Professor Gustavo, we are very honored that Professor Gustavo with his family member were here in 2019 during a Research Club meeting where we actually celebrated Dr. Gustavo's younger daughter, Rafaela's birthday. So we have a lot of sweet memory with this Research Club in the history of its inception, 2017. And this backbone of this one are our departmental, each and every colleagues of the department, our department, each colleagues, and with Dr. Shumangala, I will ask him to introduce our departmental colleagues. She will do it. And beside that, the university itself, Medical School of Medicine itself are part of the Research Club and they are being part. So it's a great honor, Dr. Luciane, that you have accepted our invitation to be a part of it. And this department, for your concern, I like to tell you, is a part of the UNESCO Chair Life Sciences. And it's a UNESCO Unit Twin program in the life sciences where biophysics, biotechnology, and environmental health is lying. And currently, I'm holding the chair of the environmental health under UNESCO Life Sciences. So these programs are also directly recognized by the UNESCO program as such the departmental any activity, including the Research Club. And this is one of the best practice. So with this, I like to tell that we have the distinguished guest here, Dr. Chinmay Shah, who is the professor and head of the physiology, but he is also a state of India called Gujarat, where from our Indian Prime Minister, Dr. Narendra Modi belongs to. So his state, he is actually heading the research under Department of, in the Directorate of Medical Education. Who entered the state, he is heading the research in the whole state as such. So he is Dr. Chinmay Shah. He is a great physiologist and also a 5-hour fellow. He's like my student as such. Yes, sir. So he's Dr. Chinmay. And I have here another panelist. So Dr. Srilakshmi Bagli, who did her, Dr. Chinmay and Dr. Srilakshmi both are MD PhD. Dr. Srilakshmi did PhD under my guidance. And she's also a hypoxia biologist and respiratory physiology. She interested and passionately involved and run a project also earlier under the government of India. under my care. Now she is also another panelist here. And Dr. Gustavo's introduction, I think that no words is there to introduce Dr. Gustavo. Dr. Gustavo, you are here. Are you hearing?
Oh, absolutely. Delighted.
Professor Gustavo is, I can only tell only one word. To me, he is my friend, philosopher, guide, mentor. He is everything in my academic research, including my family. And his family members are like my family members. They visited here. I too also visited La Paz, the beautiful city of Bolivia. So this is a wonderful relationship. Besides, I'm not discussing about his academic and research, high quality research and academic strength in the world and global perspective. Personally, Professor Gustavo is my very good guide, friend, and philosopher. Here is Professor Gustavo. Now I request to Dr. Shumangala to introduce your departmental faculty member by name. Dr. Shumangala.
Yes, a very good evening to all, and hearty welcome to today's guest, Luciane ma'am, and of course Gustavo sir and Chinmay. I would like to introduce my faculty, Dr. Manjunath Aihta. He is a professor and former head of the department. He headed for 8 big years of this department. And sir is a very excellent teacher, and sir is also a Kannada literature specialist. Next is Dr. S.M. Patil, Dr. Lata Monur. She is a coordinator and director of IQAC at presently, and a professor of physiology, a very dynamic person. Then Dr. S.M. Patil is an associate professor, and he is now presently heading the coordinator of allied courses in the department. Then is Dr. Srilakshmi Bagli. As you all know, she is one of the panelists already, MD PhD, and heading the vascular laboratory for many research projects which are carried out under the guidance of Kushal Das sir. Then Dr. Jyoti Kodnapur. She is present coordinator of research club, this research club, as well as she is looking after the coordinating the Center for Yoga and Exercise Science under Physiology. Then is Dr. Gohar Banu. She is presently pursuing the PhD under Das sir, and she's almost at the verge of completing in almost a couple of months. And she's associate professor and doing looking after IQAC in the departmental work. Then is our Dr. Sujata Kalekoti. She is assistant professor and looking after all the various headings of nursing timetables and schedules, and also a Kannada teacher in the department. We are teaching Kannada as an additional language in our local language in the Bijapur district for all our medical students. Then is Dr. Pallavi Kante, who is also a PhD scholar, and she's just young budding scholar, research scholar in the department. So this is our faculty member, of course myself and Das sir, all of you know. So thank you so much.
Thank you, Dr. Shumangala, for introducing. I think that now program will start, and I request on behalf of the research club to Dr. Luciane to present her findings, observation in her area of research. We are excited very much to listen you. Over to Dr. Luciane.
Dr. Srilakshmi will introduce the madam.
Yeah, before your presentation, Dr. Srilakshmi Bagli, who will be introducing you to the guest. Over to Dr. Srilakshmi. Dr. Srilakshmi.
A very good afternoon, everybody. I hope I am audible.
Yes.
Yes, you are audible.
It's my proud privilege to introduce today's distinguished speaker, Dr. Luciane Gargiogloni. I have been hearing about her from my mentor, Dr. Professor Kushal Das sir, about her research work. So I'll briefly introduce her to today's gathering. Dr. Luciane holds a degree in biological sciences from the Faculty of Philosophy, Sciences and Letters of Ribeirão Preto, University of Sao Paulo. Master's degree in Physiology from the Faculty of Medicine, University of Sao Paulo, PhD Sandwich, University of British Columbia, and PhD in Physiology, University of Sao Paulo. She has a postdoctoral degree at the University of Calgary, Canada, and the Centre National de la Recherche Scientifique, France. She is currently Associate Professor at Sao Paulo State University. She has a wide experience in physiology, focusing mainly on respiratory physiology and comparative physiology on the following subjects: hypoxia, hypercapnia, sexual dimorphism, prenatal stress, ventilation, thermoregulation, locus coeruleus, serotonin. She has more than 100 publications to her credit, focusing on breathing control. Here I present Dr. Luciane Gargiogloni, today's distinguished speaker.
Thank you very much, Dr. Vargas, and thank you, Dr. Kuzawa and Dr. Gustavo. It's an honor for me to be here today, presenting some of my work that I have been performing with my students in my lab. So today I'm gonna talk a little bit about the drug exposure in pregnancy and the possible impacts of the use of these drugs in the respiratory control system. So to start, as an overview of my lecture, I will touch briefly about the development of the respiratory system and the sex difference, which I think it's very important to highlight here. The prevalence and nature of substance use among pregnant women, the possible consequence of this substance use during pregnancy, not only to the respiratory systems, but also to behavioral, and this behavior can have also long-term consequences. The prenatal exposure to fluoxetine, diazepam, and cannabinoids, which will be the drugs that I'm gonna talk and stress here in rats and the effects on the respiratory system. And finally, I'm going to go a little deeper in the exposure of some cannabinoid agonists and the consequence, not only.
Yeah. Can you put your slides on a slideshow mode?
It's not?
No, because slides are not moving.
Presentation mode below the screen, Luciane. Click on the bottom screen presentation. We're seeing all your slides.
Yes. It's okay here.
There you go.
Ma'am, kindly
it's okay for
click
you
on the
now?
slide.
Full screen mode. Below you'll be
Slide.
finding. In your PPT below, your laptop below you'll be finding.
She did click, but somehow we continue to see all slides.
Can you once again unshare and then share it? Now you share full screen.
Okay.
Yeah.
Yes.
Okay.
Yes,
Perfect.
it has come. It has come. Perfect.
Okay. Sorry about that. I didn't
Yeah,
know
yeah.
that was.
Yeah.
Okay. So before I start, I would like to thank my financial support also for all this research I'm going to present here. The São Paulo State Foundation for Research, the National Council for Development and Technology, and also CAPS. Well, we all know that early life period is a very vulnerable period, and some insults that can occur during this period can have long-term consequences. And regarding the development of the respiratory system, this system starts to develop very early during development, during pregnancy. So here we have a video showing some fetal movements recorded by ultrasound, and these movements, these fetal breathing movements, they start to appear in the 10th to 12th week of gestation. At the beginning, these movements are very irregular, episodic, but then they start to become more regular and also non-episodic. And despite the fact that all the gas exchange during this period is performed via placenta, the lung and also the respiratory control system, including the motor control and also the lung, must be ready at birth so the baby can, and the neonate can breathe and to supply the adequate oxygen demand and also to eliminate CO2. So here I have some studies regarding this initiation of breathing movements, but now in rat embryos. So here we have a preparation that is very used to record breathing in neonate and also embryonic rats. So this is the brainstem spinal cord preparation. And from the record of C4 nerve, we can see some respiratory related movements. And as you can observe here, this recording of these respiratory movements, they can start to be seen at embryonic day 17. And as in humans, they also starts to become stronger and regular as the neonate is ready to birth. So here you have the E21, which is embryonic day 21. This is the last day of the gestation when the baby is ready to birth. And at the same time, we also can have to record the region of the brainstem, which is located in the medulla, that generates the respiratory activity. And this region is located in the ventral surface of the medulla and is called the pre-Botzinger complex. So we can also start to see these breathing related activities from embryonic day 17. And also again, as I have mentioned before, they start to become stronger and regular as the development progresses. One thing that I think it's very important to highlight here is that even for the maturation, the puberty, there is some difference between male and female regarding the respiratory system. Not only the brain as an area that you generate breathing, but also in the lungs. So here we have a graph showing the release of the pulmonary surfactant, which is the substance that will be produced by the lungs, and to avoid increasing the superficial tension. And in females, this substance starts to be released earlier compared to males. So here we have a gestational age of a sheep, and we can see here that there is an early rise of the release of this substance in females compared to males. So if by chance we have a prenatal birth, females are more, there is an advantage compared to males because they have already the surfactant being produced by female compared to males. This is also true not only for sheep, but other mammals species. So here we have a graph showing for man, rabbit, rat, mouse. And we can also observe here that females, they produce and they release the surfactant before males, okay? So this we call male disadvantage, okay? So it's males, the neonate males and also preterm babies that are from are males, they have this kind of disadvantage because their lung develops before, develop after compared to females. So this is caused by a lot of factors, including genetic, hormonal, and also growth factors. I'm gonna point some of here. So in males, we know that this kind of disadvantage is caused by a later surfactant production, also there is a transport of a sodium potassium pump, which is responsible for clear the liquid from the lungs. And then when the baby born, what happens is that this fluid must be all expelled from the lungs. And in this, in male babies, there is a lower activity of this pump compared to females. So here can occur some accumulation of this liquid, and then we have a kind of respiratory distress, which is more common in male than in females. And this is caused by an increased hormonal activity, specifically testosterone, which is, there is a peak to cause masculinization, and this is not the case for women. So women, there is a lower density of androgen receptor and a higher density of estrogen receptors, and this will cause a higher development of the lung and more faster development compared to males. So regarding pregnancy, pregnancy is a period for women which is also very a lot of happiness, but also a period that very doubts can surge. So during pregnancy, we have observed a higher prevalence of mood disorders, such as depression and also anxiety. And these disorders also increased after the pandemic. So here we have a graph, a table showing this. So before the pandemic, the occurrence of depression during pregnancy was around 15%, and anxiety 29%. After the pandemic, the prevalence of this mood disorder increased a lot. It was for depression 40.5% and 7.2% for anxiety. So it's a very critical period, and there is a doubt for the physicians to treat or not to treat. If untreated, if the pregnant remains untreated, can cause harmful effects to the fetus, but also until that what point we can treat this pregnant woman and not interfering in the fetal development. So here we have a graph showing the use of these prescription medicines in pregnancy. In this graph, they show specifically the use of antidepressants. So we can see that there is an increase in the use of these medicines during pregnancy. And here we have before the pandemic, after the pandemic, this use can increase even more. And I'm going to highlight here one of these antidepressants that I'm going to talk here, which is the selective serotonin reuptake inhibitors. It is one of the classic antidepressants that has been used to treat depression. And not only the depressive drugs has been used, but also another drug, such as the benzodiazepines, anxiolytic drugs to decrease anxiety during pregnancy. So we can see here these drugs here in purple, they also are increased the using in the last decades. And I'm going to talk a little bit here about one of the drugs of abuse that has been also a very problem, because most of a study performed with American women, they saw that they think that cannabis is not harmful to the fetus, that can't cause any problems to the fetus. And they are using these marijuana and cannabis drugs at the beginning of pregnancy mainly because can prevent the morning sickness, because this drug is a potent antimimetic drug. So this drug is also increasing the use with legalization and also a higher accessibility of cannabis in different countries, include Canada and some states of the United States. As we can see here of this This is a graph from NIH, and this is for United States also, the average number of pregnant women that has been using marijuana during gestation, which is not low, and marijuana is one of the drugs that's most used during this period. What the possible consequence of the use of these drugs? For antidepressive drugs, we have some studies that have shown that the use of these selective serotonin reuptake inhibitors, Prozac, fluoxetine, sertraline, they can cause the persistent pulmonary hypertension in some neonate babies. And also they can increase the risk of preterm babies. Regarding the benzodiazepine, also, the use of these drugs during early gestation can cause some congenital major formation and also a higher need for ventilatory support. And regarding the use of marijuana during pregnancy, we have some studies mainly related to behavioral changes that can occur. So these studies show that the use of this drug during gestation can cause long-term effects, and including decreased birth weight, decreased dopamine receptors. We can cause some changes in motor control, in early development, higher aggression, high anxiety, some problems in verbal communication. In adolescence, also we have an increasing depressive symptoms. So we decided to study the use of all these drugs, but not only related to behavior, but what the impact of the use of these three classes of drugs in the respiratory control system. Are they harmful? Are they change the development of the system? So we studied three main drugs. The first I'm going to talk here is fluoxetine, which I have already talked, that there is a selective serotonin inhibitor. And the main, what this drug will cause, so here we have a presynaptic neuron and a postsynaptic neuron. These neurons release serotonin in the synaptic cleft. So normally we have the release of serotonin, serotonin binds on its receptor and then is reuptaken by this transporter here. The SSRI drugs, fluoxetine drugs, they do not permit serotonin back to the presynaptic cell. So serotonin remains acting here in the synaptic cleft, binds on its receptor. So it will decrease the depression symptoms. The other drug that I'm going to talk here is diazepam, which is an anxiolytic drug that also has been used during pregnancy. And the main mechanism that this drug is acting is by binding on GABA-A receptors. When we know that GABA is one of the most non-inhibitory neurotransmitters that we have in our central nervous system. And when GABA binds on its receptor, it will cause an entrance of chloride, which is an inhibitory ion, and you cause it hyperpolarization. But this hyperpolarization is not located in some specific region of the brain. It is a generalized hyperpolarization. And finally, I'm going to talk about a cannabis model, which in our lab use a drug called WIN55212, which is a cannabis CB1, which is the receptor, cannabinoid receptor 1, and we will mimetize the use of this drug in the central nervous system. So our general model for our studies, what we performed, we crossed the animals, and then after 1 day, we detected we analyzed the vaginal smear and detect sperm. And when we saw the sperm by histology, we implant an osmotic pump in our females. And this osmotic pump, you release one of these drugs, or fluoxetine, or diazepam, or the agonist for the cannabinoid system. And then we wait 21 days for gestation. And after birth, we remove the osmotic pump from the female. So you are interested only to the effect during gestation, not during lactation. And then we evaluated the offspring. We evaluated from P0, P6, P12, and juvenile. So we evaluate like a medium term the effects of the use of these drugs during this period in the respiratory control system. So here's just a picture showing our osmotic pump, which is filled with the fluid that we want, vehicle or the drug. And then we insert this drug here as subcutaneously, and then the female remains 1 hour after the implantation. Female is okay. We use normally isoflurane, which is a very fast anesthetic. So for fluoxetine, these experiments were performed by my former PhD student, Vivian Biancard, who is today at University of Alberta as a postdoc. And the fluoxetine starts to release the drug from the embryonic day 15 until the embryonic day 21. We decided to choose this period because the last trimester is the period that can cause a higher depression in the pregnant woman, and higher use of this drug is reported in the literature. Regarding the diazepam, this experiment was performed by Carlos Silva, my former PhD student, who is now working at William Mary's College in the United States. And the pump released the drug during all the pregnancy. And finally, for the cannabinoid model, was performed by my postdoc student, Luis Gustavo Patroni. He used the release of the drug was also performed during all over the pregnancy. So as our results, what we observed regarding birth outcomes, we observed that the use of prenatal diazepam caused some harmful and deleterious obstetric effects. What we observe is that delayed birth, instead of 20 days, 21 days, the birth will occur 22 and a half days after the beginning of the gestation, presence of stillbirths, and unsuccessful pregnancy. So this was observed when we studied the diazepam treated animals. Regarding the use of cannabinoid agonists, what we observed was an increase of mortality at birth, around 30% of increase in mortality. For fluoxetine, we didn't see any birth outcomes changes compared to the diazepam and also WIN-treated animals. Well, regarding the body weight, what we observed is that both fluoxetine and benzodiazepine treated animals, they have the increased body weight in juvenile stage, both males and females, and they have this increased body weight probably because there is an increase in food consumption. It seems that the use of these drugs, both fluoxetine and benzodiazepine during pregnant period, will cause a delayed effect, which is a higher body weight in this offspring. Regarding the behavioral, this is our animals that were treated with vehicle. The mother were treated with vehicle, and the mother were treated with cannabinoid agonists. What we observed here at these animals that were treated with cannabinoid agonists, they have hyperactivity. They have like this tremor behavior, is head shaking behavior, is more common here in the wind-treated animal compared with our vehicle-treated animal. We believe that this is kind of withdrawal symptom, which is also observed with other drugs such as morphine. When the mother uses morphine or another opioid, they also show the same kind of behavior: hyperactivity, a higher motor activity, and head shaking, which is a consequence of the use of the drug during pregnancy. Well, regarding our respiratory results, so in our graphs, normally blue will be for male and red will be for female. Our empty symbols will be for our vehicles animals, and filled symbols will be for our treated animals. So here our graph for fluoxetine, benzodiazepine, and also the cannabinoid agonists during all these stages after birth. So P0, P6, P12, and also juvenile state. What we observed here is that the use of the benzodiazepine during gestation caused hypoventilations in males at P12 and P21. This is very a consequence that we are very have to pay attention, because P12 is considered a critical period for rodents, specifically rats. And at these critical periods, there is a higher occurrence in the what we call the descendant infant death, which is SIDS. So for humans, this is very common at this, what we call the critical period. It's more common in males than in females. So we can see here that the use of these drugs, benzodiazepine specifically, during this period can cause this harmful effect, which is hypoventilation, that can predispose these animals to have some kind of disorder, such as SIDS. Regarding the use of our cannabinoid agonists, we also observed a change in the respiration, which is hyperventilation. You can see here that our males were hyperventilation compared to our vehicle animals. So this is kind of related to, we also explain this later, but can also predispose these males to some kind of anxiety disorders. As fluoxetine, we saw no difference compared to our other treatments. For females, we also have some changes, but not related to breathing, but metabolism, which was evaluated by measuring oxygen consumption. So we can see here that juvenile females, they saw a hypermetabolic state compared to our vehicle. And for benzodiazepine, we saw that our P0 females, they have a hypometabolism compared to our vehicle animals. As to the respiratory stimulation, so we submitted these animals to some respiratory stimulus, such as hypoxia, which is the low level of oxygen, and also hypercapnia, higher level of CO2, to see if their chemosensitivity was altered by the use of these drugs during pregnancy. And what we observed is that during hypoxic response, we have not many changes compared to what we will see in hypercapnic stimulation. So what we observed during hypoxia, we saw that animals that were treated with fluoxetine during pregnancy, they have an increased hypoxic ventilatory response in juvenile phase, only for males, and for cannabinoid agonist treatment, we saw mainly an increased hypoxic ventilatory response at P0 and a reduced ventilatory response in P6. So I'm going to talk a little bit later about what is possibly causing this reduction in this sensitivity in these animals. As to the CO2 stimulation, what we saw is that in females, treated with fluoxetine, we saw an increased hypercapnic ventilatory response in P0 and also in juvenile females, P24. And the opposite response was observed for here in P12 benzodiazepine treated drugs. So we believe that these changes here, we know that some anxiety disorders, such as panic disorders, can cause higher sensitivity to CO2. And since these females are already has a higher CO2 sensitivity compared to their control, this can cause a higher susceptibility of these females to have panic disorder at adulthood period or even in adolescence or teenager during teenager period. Also regarding our cannabinoid use, we saw that during hypercapnia, both males and females, they present also a higher sensitivity to CO2, a higher hypercapnic ventilatory response, which as just mentioned here, can be, these animals can become more susceptible to have some panic disorder because these patients are highly sensitive to CO2 stimulation. Regarding we also not only analyzed the respiratory control system, but also analyzed some respiratory neurons that are located in the brainstem. We evaluated the number of serotonergic and also noradrenergic neurons located in the brainstem and some nuclei. So this is our results for benzodiazepine treated animals. So here we have the our serotoninergic group. So we count the number of the serotonin neurons in vehicle animals and also in our control animals. Sorry, this is the catecholaminergic neurons, not the serotoninergic. And what we observe here in general is that the use of benzodiazepine drugs during development causes a decrease in the number of these neurons in P12 animals. So all these changes in ventilation, the lower ventilation that we are observing in our animals can be caused by a lower number of these noradrenergic neurons, because we know that noradrenaline is normally excitatory for respiratory rhythm. So since we are observing a lower ventilation in our benzodiazepine treated animals, this can be caused by the lower number of catecholaminergic neurons located in the brainstem. So here now we have the serotoninergic neurons. So here we have some RAF nuclei, which is the group of the brainstem that produces serotonin. We also observe some decrease in the number of serotonin in some RAF nuclei, specifically in males, which reminds us that males are more susceptible to these changes than compared to females. So we also evaluated this in our wind-treated animals, the cannabinoid-treated animals, and we also observed some changes in the noradrenergic and also serotoninergic neurons. I'm going to highlight some important changes that we observed here. So in P0 animals, we mainly saw increasing the number of some noradrenergic neurons in some areas, such as A1 and nucleus of the Detritus solitarius. And we also observed an increase in the number of A6 neurons, which is locus coeruleus. You can clearly see here, this is the locus coeruleus located in pons. This is our vehicle animals. This is our treated animals with the cannabinoid agonist. We can clearly see here a higher number of neurons located in this area compared to our vehicle animals. And for females, the only change that we observed was a decrease in serotoninergic neurons in raphe neurons, which can be related with hypoventilation observed in P6 animals in P0 age at these animals. So to summarize all these changes that you observe here, to make clearly our results, with fluoxetine, we saw no changes in the birth outcomes and also no changes in basal breathing. We observed a higher hypercapnic ventilatory response in females, and then we are going to observe the same results in the juvenile females. A hypermetabolic state in these females also, and a higher hypoxic ventilatory response. So it seems that fluoxetine used during pregnancy has medium-term effects that will affect both females and males, but it seems that females are more sensitive to the use of fluoxetine compared to males. As to diazepam, what we observed here as our birth outcomes, we saw delayed birth, stillbirth, and unsuccessful pregnancy. We saw a decrease in oxygen consumption in females at P0, and we saw changes in both the critical period and also in adult stage. We saw a hypoventilation, which is, as I told you, is a critical period, so it can increase the susceptibility of some disease such as sudden infant, that is is more common in males than in females. We also observed a decrease in CO2 sensitivity and a decrease in the number of noradrenergic neurons in both males and females, and serotoninergic neurons in females. And we also saw some changes during this juvenile period, which was increased body weight and a hypoventilation in males. And finally, for our animals that were treated with WIN, which is our cannabinoid agonist, we can see here that we have a lot of changes during all this period. So we have increasing mortality at birth, increase of tremor behavior, which is withdrawal behavior, increased hypercapnic and hypoxic ventilatory response, and a higher TH positive neurons, which is a higher number of catecholaminergic neurons, and lower number of serotoninergic neurons. We also saw changes in P6. Here we have a kind of inhibition of hypoxic and hypercapnic ventilatory response and a higher number of catecholaminergic neurons. And for P12 and for P27, P28, we saw a higher chemoreflex response for both hypoxic and hypercapnia. So now I'm gonna focus a little bit, this is the last part of my lecture, regarding cannabis and pregnancy. So as we saw here, this is the drug that we saw effects in all ages that we studied. And also we decided to focus more on our study this because of the legalization of these drugs, and also some studies showing the importance of generate more data. So this is a study for Nature Medicine, and it's kind of to pay attention because the use of this drug is increasing, and also some pregnant women, they think that there is no problem to use this drug during pregnancy, and even they are using to decrease the morning sickness. And this drug, as I told you, then can cause some harmful effects even during adulthood. So in these animals that we are treated, the pregnant women that we treated with cannabinoid agonist, we also evaluated the CB1 expression in these animals. And we can see that there is an increase in CB1 expression in males compared to females. And this increase in the brainstem CB1 expression is observed from P0 to P12. This is normalized by during juvenile period. No change was observed in female. We also analyzed the pulmonary compliance. Since we saw many changes in these animals, we decided to evaluate if there is a change in the mechanical component of the respiratory system. So as we see here, we can observe some changes here, such as the insufflation and also deflation. We saw that at juvenile period, we saw a decrease in the static component. It seems that there is a more rigid system. And for compensate that, these animals are increasing the tidal volume to compensate this more rigid system that we can see because of they have a lower compliance compared to our vehicle animals. So we can pay attention here that not only the neural control system has been affected, but also the mechanical component. Since we saw there is some studies showing that our CB1 receptors located in the lungs. So the use of this drug during pregnancy can cause some harmful effects here in the mechanical component of the lung. So we also saw some change, not only the static component, but also in the dynamic component. So here is our male treated with WIN and our male vehicle. We can clearly see a huge difference between these two groups. And as I told you, these WIN treated animals, they have a higher and more rigid system compared to our controls. And as I would like to draw your attention here, the effect was only observed in males, not only females. So that's the importance to study males and females. We can draw conclusions for females based in a male study, because here we have a huge difference in males and no difference in females. And we also performed some brain in situ preparation to evaluate the discharge of the phrenic nerve activity. So phrenic is the nerve that will innervate the diaphragm. So we would like to see if we have some changes in this motor control. And again, in males, we saw a higher amplitude of phrenic nerve discharge, which seems to be compensating this more rigid system of the chest wall. And in females, we saw no change. And finally, our last results, we also evaluated the mitochondrial respiration located in neurons in the brainstem. But why the mitochondria? Because mitochondria also, the outer membrane of the mitochondria possess CB1 receptors. So marijuana, cannabis also can bind on neuronal mitochondria receptors. And we observed that also in males, we have some change in P0 animals and some in P12 animals. To summarize this change, it seems that the mitochondria of these animals is not reaching the maximum respiratory capacity. So it is with a higher uncoupling, but not working properly. This is also observed only in males. So here we have our summary of all results that we observed for our cannabinoid study for male and female. So we can see here that all these changes, all these parameters that we evaluated, most of them occurred in male compared to female. And it seems that these animals, they have a higher hypercapnic sensibility, which can cause a predisposition of this animal to some anxiety disorders such as panic disorders, okay? So as a conclusion of my talk today, my take-home message is that we observe some sex-specific effects in prenatal use of fluoxetine, diazepam, and our cannabinoid agonist. So we can have some kind of note of caution because the use of these drugs, both benzodiazepine and mean, they have some birth outcomes. We observe a higher CO2 sensitivity in some treatments, and this alteration may increase the vulnerability of these animals. In the case of the diazepam, we saw that our animal would have a lower CO2 sensitivity. And in our case, the case of fluoxetine and cannabis use, we saw higher sensitive, we can predispose these animals to panic disorders. And we believe that our study raises a note of caution that might be considered when the potential therapeutic or recreational use of cannabis-based medicines are defined and regulated for pregnant women. With that, I'd like to thank all my collaborators, first the students that perform all these experiments that I have shown here with Gustavo, Vivian, and Carlos, and all my collaborators that help us with develop all these protocols. So our lab is, we have an Instagram and Twitter, and we posted all these new publications and also some events that occurs in the lab. With that, I will finish my lecture, and thank you all for being here and paying attention.
Thank you very much, Luciane. It's an excellent talk. And yeah, it is excellent. It is a wonderful and amazing. There are chairperson of the session is Professor Gustavo. I want to hand over to him first. And then the two panelists are there, Dr. Chinmay Shah and Dr. Selective Bagli, both are physiologists. And then it will be in the publics and in distinguished our many students are also there, PhD scholars are also there. So I think there'll be interesting part of it. Dr. Gustavo, please go ahead.
Well, I must truly say that I have enjoyed your talk tremendously, Luciane. Really, really, really nice. And you're touching at such a fundamental aspect that in the current times creates so many problems because of the stress of life on top of pregnancy. And you very well showed COVID also as a strong stressing factor that has induced the use of some of this medication. I have always been against the use of any medication during pregnancy, and maybe I could almost say almost all through my life for my use. I don't use any drugs at all. So I'm kind of a Ayurveda type of philosophy because there's wisdom in that. You know, I'm very briefly, let me tell you that it's a delight to be present because I can focus it in 3 dimensions here to be present in this talk. The first, as a visiting professor of BLDEDU University, and to be sharing the time with Dr. Chinmay Shah, Sarafi Chibastava, and Dr. Sitami Bagali. It's I'm also remembering through them Professor Biradar, who was the vice chancellor, who unfortunately left us due to COVID, and also the coordinator, Dr. Giotti. I know many of these people in India, and Luciane, I'm happy you're joining this group because this is an outstanding group in India, and I'm certain you will be visiting them sometime in the near future, and it will be a very enriching experience. I'm also, the second dimension that makes me happy to be here is because we are uniting India, Brazil, and Bolivia. Of course, we are not on the same level as countries. You too, India and Brazil, are part of the BRIC countries, the great countries of the forthcoming future. And And I can see that through your presentation, the quality of the work in Brazil is truly amazing. The quality of scientific work that you are doing with great impact. And the same with India. I have seen it through these years as a visiting professor, visiting twice BLDE and giving talks there. I have seen the growth and the development of India in the scientific areas, particularly with BLDE. And so that's wonderful. And Professor Kusal Das, of course, the mastermind behind all this, is the mastermind that we gathered today, which is wonderful. He's also the UNESCO man in all these meetings, which boosts the importance of such a meeting to a very high international levels. And of course, all the professors and students of BLDE who I am always delighted to meet. And the third dimension that makes me happy to be here is the physiology and joy injection. Beautiful physiology. The level of your work is truly beautiful, not only in the physiological aspects, but also in the molecular aspects. And finally, let me comment that once again, you prove that women are superior to men in all ways. Because, you know, even with the use of drugs, your responses are really fantastic. And that's the wisdom of nature. Nature creates women as the tool for the reproduction of more beings. And so women are truly stronger. And I am congratulating myself to have two daughters, which are women, and that I have not made the mistake of bringing a boy to this world because he would be a weak being. And so it's wonderful. Luciane, by the way, Luciane and Natalia, my daughter Natalia, is now in Calgary, at the University of Calgary, where you have been. Hey, yes. And she is doing a PhD, and she's really enjoying it. He's with Richard, and she's having a wonderful time, and we're doing really nice works. And Dr. Patil, it's wonderful to have you, to see you once again. And so that would be my part of participation. I would like to ask Professor Kusal Das how we proceed now.
Yeah, thank you, Dr. Gustavo. Thank you, Professor. It's an excellent that, and thank you very much for introducing BLD in a very few words. And because you are a part of our university as a visiting professor, and you have visited this institution, I think 3 times. And
yes.
Yes. So yeah. You are almost, we all remember you like anything, and we expect the same thing that Dr. Luciane will in future will visit us, and there will be a collaboration between your university, your laboratory, and with our laboratory. And my scholars are here in front. Actually, one of the Dr. Sulashmi is, she was my former PhD student, and also currently heading the this one, what is it called? My laboratory, specifically, she's heading, and I'm very proud of that. I will not ask you any question. Let the panelists ask the question. So one of my very popular and very favorite student, Dr. Chinmoy Shah, who is also an MD PhD, is here. So first Dr. Chinmoy Shah, and followed by Dr. Silashmi. Later, all the other PhD students will be getting privilege to ask interaction with Dr. Luciane. Over to Chinmoy.
Good afternoon, sir, and good morning, Luciane. It was an excellent talk. And as Professor Gustavo said, the second X present in the gene of females is helping everywhere. To take any of the genetic disorder or any disorder, the second X is there to help the women's like anything. And on a lighter note, our spelling is he, H-E. And your spelling is C, S-H-E, means super he. So again, you have proved it that you are superior than us.
Yes. Good point.
So,
beautiful.
Going through the practical aspects of your experiment, as you know, that when we are talking of pregnancy, actually we are dealing with the two life, mother and child, either maybe she or he. And there are certain drugs we actually can't avoid. even if we want to avoid it. And if we look at it very judiciously, sometimes we may interfere with the proper treatment of the pregnant lady. So I would like to ask you one question, ma'am, that as you know, during the pregnancy, the pharmacokinetic and pharmacodynamics of the drug is changed because of different metabolic changes in the pregnant lady. So during all this study, have you ever tried to dig deep into it regarding pharmacokinetics and dynamics changes in animal experiment?
Question, and we have not observed this pharmacokinetics, but we can clearly see that our females were treated, especially with cannabinoid agonists, because the behavior of the offspring is very, we can see very clearly the hypermotor activity and the change in behavior that is like the drug is acting on them. The point is that the placental also, I did not comment, but it's something that I would like to study. The density of receptors of female and male placental is different. So maybe the effects of the drugs being different in males and females is also because of this, not only the pharmacokinetics, but also changes the density of receptors of these drugs in the placenta that is also different in males and females. And one point that I forgot to mention in my lecture is that regarding the receptors sensitivity and density, CB1 receptors are, they have a higher density in the brain of males than in females, and also they have a higher sensitivity. So maybe the effect that we observe is higher in males because of this higher density and higher sensitivity. In general, not only the wean-treated animals, but in general, for men and women, CB1 receptors are common, more common in men than in women.
The second question I would like to ask is the 3 drugs which you have used in present experiments are, if we talk regarding India, these are less frequently used drugs. So are you planning in future to do an experiment on routinely used drugs, which are frequently used, means in most of the times?
Other drugs, what kind of drugs are you referring?
For example, in India, we are more fond of using antihypertensive, anti-diabetic. So what 3 drugs you have used are very rarely used in India as far as India is concerned. I think Dr. Srilakshmi will agree with me that we need to focus on the drugs which are more frequently used, so we can save more life and we can prevent more danger happening to the kids.
Yes, we are thinking and also is study this drug that has to be used, like these antihypertensive and now anti-epileptic drugs, because these drugs the woman can't stop to use because it's So we are. I have one student that is thinking into study these anti-epileptic drugs, but it's very good idea, this antihypertensive. And one thing that I think will be very good to study also is regarding vitamin D. The difference in the vitamin D, because in some countries we don't have some and don't have, and women did not replace vitamin D, and we want to know if these changes in vitamin D use and the lack of this vitamin can cause some harmful or change in the respiratory system in our offspring.
Great. Over to you, Dr. Srilakshmi.
Thank you so much, Dr. Luciane, for the lucid presentation. And even I have been working on hypoxia. I worked on hypoxia and cardiovascular pathophysiology in albino visitor rats. So I have few questions to you, ma'am. did you look for any dose dependence of the drug and the changes in the offsprings? For example, if you administer low dose of these 3 drugs or versus high dose, are the changes in the neonatal rats similar or they vary? Did you look for the dose dependent changes?
What we choose is doses that have been used in the literature. And also, if we increase more the dose, for instance, for benzodiazepine, we can cause an increase in mortality. So we decided to use a dose that has been used in the literature and also a dose that corresponds to the dose that has been used in humans. We try to make a translational study. Regarding the cannabis study, we choose this 5 milligrams because it is related to a quantity of 1 or 2 cigars of marijuana a day during pregnancy. That's a research that we saw in some study from United States and Denmark that corresponds to the amount of drug that has been used during pregnancy for this woman. So we decided to choose. Of course, I believe that the change of the dose will change totally the results that we can observe. If you increase the dose, we can increase the mortality, and also we can increase the changes that you are seeing in the results.
And in the neonatal rats, how long these changes persist, ma'am? They persist for a long period throughout the lifespan of the animals, or they are only for a few days after birth these changes persist?
I evaluated them like P0, which is, I think it's a critical period when they born, they are very apneic, and I think it's the period that we have to evaluate them because it's a very sensitive window. So we evaluate them at P0, and then we wait 1 week more. And we did not evaluate every day, 0, because it's very stressful also for the mother to remain taking of the babies of the mother. So we decided to study P0, P6, P12, and juvenile state. So at this stage, we can see that clearly that for some drugs, specifically for cannabinoid, the effect remains all over the period. It's kind of short term. I did not present here, but I have some data regarding adulthood, and we still see the effect during adulthood. We see higher CO2 sensitivity. We also evaluate changes in sleep-awake cycle. We see that our animals that were treated with cannabinoid, they have lower time of sleep compared to the animals that were not treated. So it is a long-term effect. It's not only at the beginning, but it remains until adulthood.
My another question is, you observed a decrease in lung compliance in following administration of cannabis. So did you study the organosomatic index? Did you look into the histopathological changes of the lung? Is there any structural change or?
It's a great point. And in fact, I have a friend that performed this kind of morphometric analysis of the lung. But at least now, we only performed experiments with compliance to see if we have some mechanical. We didn't go to the histology of the tissue, but it will be very interesting because I think it must be having some changes in the, I don't know, the membrane, the respiratory membrane, or even the pneumocytes of the cells, because the changes are very expressive, like the pulmonary compliance, specifically at P0 and P12, we can clearly see this change. So it's something that we want to do in the future. We have some students collecting some tissues of the animals now, the brainstem, and also the lung will be a good point to study also. Thank you for your
question.
Thank you.
Thank you so much.
Yes, thank you very much, Dr. Silakshmi. I request the other, Dr. Shureka, are you here?
Yes, sir. I am here,
Yeah,
sir.
yeah. She is Dr. Shureka Ipagi. She's a professor of pathology and also doing PhD. And she is my student of PhD in she's also doing work on the line of the neurovascular system, specifically. Dr. Shureka, please,
sir.
please go ahead with Dr. Luciane.
Hello, good morning, Luciane madam. Just I wanted to have one clarification about the drug. When the drug is given in gestational period, so once the rats are delivered, does it act like a withdrawal symptom? Because now drugs are removed. That when it is in the gestational period, the transportation of drug will take place. Once there is a delivery, whether it is a does it act like a withdrawal symptoms? Because now drugs are not there.
Yes, good question, Shrek. One point that is very important to
No.
highlight. Are you listening?
Sorry,
Can you hear me?
Now it is audible.
Okay.
Pardon.
The point is that even after gestation, if we remove the pump, we can have the occupations for fluoxetine. We can have the occupation of the search transporter at least 1 week, for 1 week in fetus. We saw some study even in human that this occupation can take like 15 days. So the drug is still there, even if not in the mother during the lactation. So this is true for the fluoxetine, and for cannabis. There are also some studies that the clearance of the drugs occurs in 2 or 3 days. And for benzodiazepine is like 5 days. So even when we remove the pump, there is some drug circulating and bind on the receptors. So these drugs can really readily cross the barrier. So if it's used even after the gestation, we interrupt the flow, the occupation of the receptors still remains for some days. That's the reason that we can observe some withdrawal symptoms mainly for the cannabinoid drug.
Oh,
Thank you.
We
Thank
also
you.
we evaluated some reflexes also that I did not show here to evaluate their motor behavior, such as the mastication reflex, which is a simulation of sucking, and also the writing reflex. We saw some changes in when we use benzodiazepine. So it seems that the use of benzodiazepine can also preclude some of these motor behaviors. Even sure.
Yeah.
Go
Yeah,
ahead. Sorry.
Yeah. You want to ask any question, Dr. Gustav?
Yes, but I didn't want to interrupt Luciane.
Okay. Okay.
No.
Luciane,
No problem. I have already finished.
Luciane, you can continue, or like Dr. Professor Gustav's question. I think it will be helping you to have a bridge between the.
No, go ahead, Gustavo.
Yeah, Professor Gustav.
Yeah, Luciane, I find it very interesting because of the effect on the respiratory center, of course, which is the respiration is crucial for life, the movement of air in and out of our lungs. And obviously the respiratory center is like the pacemaker, which is altered according to your work. But I am fascinated also by the fact that you looked at the compliance. First question is, why did you think of looking at the compliance? Because that is quite curious that you would have done that observation with my tocayo, with the scientist called Pedro, who is also Gustavo, which is really nice. Okay, but the other thing is, how do you explain this compliance alteration? And of course, as a pulmonologist and working at high altitude, this is a fundamental aspect of ventilation that can bring forth many pulmonary lung function alterations throughout life. Is this an elasticity alteration? Is it a direct effect of the drugs on the development of the elastic properties of the lung? Or is it an interference somehow? How do you explain it, Luciane?
Thank you. It's a very nice question. And honestly, I don't know. I don't know how to explain properly it is elasticity or another complaint. The curiosity to evaluate this is because we saw changes in tidal volume. And when we see changes in tidal volume, you can see central or can see also mechanical. And we decided to evaluate because we have a higher density of CB1 receptors in the lung. So maybe we saw, we were discussing, maybe this change that we're observing here is not only a central component, maybe can be something related with the lung or the, so we decided to perform these experiments because of the fact that we have receptors in the lung and the fact that the change that we are observing is mainly in tidal volume. So when we evaluated the compliance, we decided to evaluate with chest wall and removing chest wall, and we perform all the changes that we observed with and without the chest wall were the same. So it seems there is some problems with this rigid. It is a rigid system. A more rigid system of these animals, and they have to have a higher tidal volume to compensate. But the reason for that, I can tell you if it's changes in elasticity or another component, because I think I have to go further, perform some histology and see what's going on.
Mm-hmm. Very interesting.
Very interesting it is. Thank you very much. And I will now request Dr. Anita Hirur. Dr. Anita, you are here? Dr. Anita,
yes, sir, I'm here. I'm here.
Yeah, I just introduced. Please meet Dr. Luciane from Sao Paulo. Yeah, Dr. Anita Hirur is doing PhD and also my student.
Yes.
But she's a professor of physiology also. Dr. Anita.
Yeah.
Anita, please.
It was a wonderful talk. Yeah,
yes.
It was a wonderful talk, ma'am. It was really very physiological and molecular level. It was a great talk. I should really appreciate it. I just want to have a question. So as to, I mean, whether it was at the surfactant level or is it at the neuronal discharge that we were talking about, the neural hypoventilation, etc., ma'am? Do you have that? Am I clear in my question?
Yes, if it's a change in neuronal discharge, is that what are you asking?
Yes. Whether it was neuronal discharge or is it the surfactant or both?
Does effect? Can you repeat? Please?
Yeah, Anita, just to once again ask. She's asking actually whether it is due to the compliance of the lungs due to the presence of lung surfactant, whether the concentration of surfactant more or the change of the surfactant due to the specific type of drug, and that causes this one, or there is a moisture also being one of the important part of the compliance also being affected or not, that is the water pressure. So she's asking that, or it is due to neuronal signal pathways by which the respiratory overall control is done. That is her question.
Yes. Yes, ma'am.
Regarding the changes that we are observing in our study for benzodiazepine and that we
Luciane, speak louder, please. Speak a little louder.
Okay, regarding the effect that we are observing with the benzodiazepine, with most of the case we observed hypoventilation in our animals in a lower sensitivity. We believe that this is caused by the decrease of the neuronal discharge of these neurons located in the brainstem, such as noradrenergic and serotonergic neurons, that we observe there is a reduction of the number of these neurons. So this can cause this hypoventilation. I can't say if something is happening in the lungs, because in this protocol specifically, it didn't study lung compliance. We only study lung compliance for cannabis use. So, but the change that we are observing here in this number of noradrenergic and serotonergic neurons are very drastic. So I think we can have an effect in the ventilation of the animals, since we have lower neurons, and these neurons are normally excitatory for ventilation. Since they are in a lower number, they also having a lower effect to increase and to promote this higher ventilation in these animals. That's the reason that I believe in this case, we have this hypoventilation.
Yes, ma'am. Thank you, ma'am. Thank you for the nice explanation.
Thank you, Luciane. Thank you, Luciane. Thank you, Dr. Anita. And now I request the PhD student, I'm more interested for PhD student. If anybody, please, you are there, a lot of students are there, PhD scholar. Anyone, please tell your name, introduce yourself. Any PhD scholar of our university? Do you like to ask question or interact? Just simple interact. It's an amazing talk and amazing knowledge she has shared with us, and definitely this will be benefiting you. Anyone is here? Okay. Any faculty member?
And if anybody is having any problem in mic, they can write in the chat box. We will ask on behalf of you also.
I think Dr. Chinmay, there are some chat box. Is it any question? No.
No, sir. No, sir.
No. Okay, fine. So anybody want to ask question? PhD scholar. Don't be feeling hesitant. No question is actually the stupid. Sure. It is the answer may be stupid, but question never is stupid. You can ask. You can ask. I can give you a wrong answer for a right question, but your question will be always right. Please ask. Sure. Dr. Luciane is a senior professor. You ask question. This is an opportunity. Anyone? Okay. So, Chinmay, that nobody asking question, I will like to conclude here. And before that, I have one specific question to share. With the permission of Chairman Dr. Gustavo, I'm just asking one question to Dr. Luciane.
Please do, Gustavo.
Yeah, actually, I thought that my scholars will be more interacting. That is more important for them. The brain, I'm mainly concerned with the brain here for the regulatory control of respiration, because brain has a two-part of control regulatory mechanism. One is the purely neuronal, other is the chemical. So here the involvement is actually looking the chemical, which is a drug, and regulatory mechanism may be through the neuronal. Now, in this part, you have observations and everything is specific to the brainstem. Yeah, obviously there is the dorsal ventral respiratory group of nerve fiber where the Bodginger, pre-Bodginger complex to regulatory mechanisms like SA node of heart. So, okay, that's fine. That is regulating all the things. But the drug, which is partly impacted on the basal ganglion neurons, cerebellar neurons, because without considering the cerebellar neuronal functional and also basal ganglion, and specifically when you come to serotonin or GABAergic on others, so dopaminergic. So in this, avoiding these two part of the brain neuronal signal procedure, and when the drug is related to these substances, do you feel that cannabis is mainly affected more than the brainstem normal regulatory system, the other part of the brain except cortex like basal ganglion and cerebellar mechanism? Because the impact and result is like that.
Oh, it's a very nice question. Actually, most of the studies that we have with cannabis using during pregnancy in rodent models is studying the forebrain, not the brainstem, because the forebrain, they have a higher density of CB1 receptors compared to the brainstem. So that's the reason that we avoid the forebrain, because it's there is a lot of studies showing that it has a lot of impact, mainly the studies that in behavioral, increasing the autism spectrum disorders, also hyperactivity disorder. So I think that, of course, with this model, we will have changes in the forebrain. But we focus on brainstem because we want to see the respiratory groups and the regions of the brainstem that are related with respiration. But I can't forget, of course, the rest of the brain. We just focus our attention in brainstem because our field, we want to see respiration.
I agree that, but because you are
yes
perfectly you did it in that part. Definitely that's a very important part you have observed. But as that part, when it concerned, because it is a concern with a specific drug during pregnancy has been used, so that has also changed the sympathetic parasympathetic balance, and this parasympathetic balance change, specifically 9th and 10th cranial nerve, will have a specific impact on the ventral respiratory group of nerve fibers. So they may regulate their respiratory system movements partly in an unknown fashion as compared to the normal rhythmic pattern generated and modulated by P-Bodginger complex. Because if the 9th and 10th cranial nerve are overstimulated or less stimulated, the impact will be different. So the study in this regard, I feel that a literature or even a conclusion dragging to the autonomic function, specifically the 9th and 10th cranial nerve to the midbrain, the brainstem region, should be also discussed in this regard to make it more polished and advanced. This is my opinion, personally my opinion.
Sure, you are right. As I would like to mention also, because we have some data regarding blood pressure, the cardiovascular system, and very impressive regarding cardiovascular system. It seems that females are more sensitive. We have most of the changes in females, not in males. So we have an increase in blood pressure in females during the puberty and also during adulthood that was not observed in males. I did not show here because it's another chapter of our study. I focus here only the respiration, but we saw changes in cardiovascular system with the use of cannabis during pregnancy. We have this data for fluoxetine also, but I'm waiting my student to analyze it. So I can't say right now what is the consequence of the use in the cardiovascular system for fluoxetine.
Thank you, Dr. Luciane. I think that we should close now because you are tired after delivering a talk and interacting.
It was very nice. I'd like to thank you very much. It was an honor to be here.
And I request that to you, in presence of witness Professor Gustav, that you should be again with us in very soon and interacting in a more platform where we'll be making more. I wish to make a platform of a talk specifically on the low oxygen environment, microenvironment, and specifically the brain rhythm controls and the respiratory regulatory mechanism by which a broad aspect, including hypoxia, to be covered. And that's I'm waiting for that, and soon we'll organize a seminar or a 3 days or 2 days seminar in the greater aspect of only in the respiratory system concerning with the brain. So it will be neurorespiratory mechanisms, a specific topic, specific area where we will be delivering talk and invite some of the distinguished speakers around the world. And Dr. Gustav is there to always support me. Professor, he always supports me in all the ventures, and we always enjoy. So I hope, Professor Luciane, your valuable talk, your input, your research is a very high quality, as I don't want to mention because panelists and chairperson already conveyed. No words on that because you have presented in a very briefly the high quality of research work. So you deserve an accolade from all of us. So claps.
Thank you very much.
Claps.
It was a
And
pleasure. Really.
I now request Dr. Jyoti, is you are here?
Yes, sir. I am here, sir.
Yeah. Please now request Dr. Prachi Kulkarni, who is a postdoctoral fellow of the department, to hand over the certificate one by one. So, Dr. Jyoti,
Yes, sir.
you are here? Yeah. You have to be ready with the vote of thanks. So before that,
Yes.
let the citation presentation be over. So, Dr. Luciane, Dr. Luciane, you please just scroll it. Just scroll it. Dr. Prachi, just scroll it. No, I think that it is it has not been shown. Can it be shown?
Is it visible, sir?
No.
No. It is not visible. Dr. Luciane, Dr. Prachi Kulkarni, postdoctoral fellow. He is a biotechnologist and biochemist. Can you scroll it? Can you scroll it?
Yes, sir.
Or
Now
you
is
can
it
reduce the size.
Now is it visible, sir?
It is visible. Reduce the size. Yes, I request Dr. Shumangala, Chairperson of the Department of Physiology, BLD deemed to be university. Dr. Shumangala?
Yes, sir.
Yeah, please.
It's my honor to present the certificate of participation for the today's speaker, distinguished speaker, Luciano ma'am. Thank you so much, ma'am, for that elaborate talk. Thank you so much. Please accept the honor.
Yeah.
Thank you very much. Thank
Dr.
you.
Luciane, we will share with you this through email. We'll share the citations, e-citation online. So thank you very much.
Thank you.
Next, I request Dr. Chinmay. Dr. Chinmay, you are here. So I request you to issue the certificate to Dr. Gustav. It is whose? This is Dr. Chinmay or Dr. Gustav?
Gustav, sir.
Chairperson. So Dr. Chinmay, you just.
Good morning, sir. Good afternoon, sir. It's nice meeting you again and again. And it's my pleasure. It's my pleasure. Miss, I'm very happy from bottom of my heart that Das sir has given me an opportunity to hand over this citation to you. Please accept on behalf of Research Society of BLD University, sir.
Thank you so much. Wonderful to have this certificate received from you and to see you once again and all the BLDD people. Thank you so much.
Thank you very much, Professor Gustav. Thank you, Dr. Chinmay.
Thank you.
Yeah. Now I request Dr. Lata is there. Dr. Lata.
Yes, sir. Yes, sir.
Oh,
Yeah.
Dr. Lata.
Yeah. I just introduced Dr. Lata to
Yes,
Dr.
sir.
Luciane.
Good evening, sir.
Good evening. Dr. Luciane, she is Dr. Lata Munlur and she is our professor of physiology and she was my former PhD student. And as you mentioned about the vitamin D, her work and during PhD was on vitamin D on cardiovascular system.
Hello.
Here is Dr. Lata.
Hello,
Lata,
Dr.
please.
Luciane. Hello.
Yeah.
Good. Hello.
Hi, how are
Yes, sir.
you?
I am good, ma'am. It was wonderful listening to your talk. Yeah, nice hearing to you, ma'am.
Thank you, Dr. Lata. Now I
Thank you,
request
Dr.
Dr. Lata and Dr. Gustav is also wishing you.
Hello, sir. Hello,
Yeah.
sir. Good morning, sir. How are you, sir?
Happy to
How are
see
you
you
doing,
once
sir?
again. My wife sends hello.
Hello, sir. Hello.
Yes.
How are you, sir?
Very good. Happy to see you once again, dear Dr.
Yes,
Lata.
same here, sir. Same here, sir. Same here.
And
So
again,
Luciane, if you go to BLDE in India, you have to be with Dr. Lata. She will take you. She will take you to buy some beautiful Indian dress like my wife has.
Most welcome. Most
Please,
welcome.
with
For
us.
sure.
We are
Yeah.
honored
It will be
to.
very nice.
Very beautiful dress in
do
India.
visit our institute, ma'am. Please do visit.
Yes, I will tell you. She loves the dresses you brought. You helped her.
Okay. Surely, sir. Surely.
So Dr. Lata, now you have one responsibility to
Yes, sir.
hand over the certificate of honor virtually to Dr. Chinmay Shah.
Yes, sir. Sir, good evening, sir.
Good
It is my honor to present you the certificate, sir. It was nice interaction, your participation. Thank you so much, sir.
Thank you very much, Lata ma'am. Thank you very much, Kushal Das sir, for making you a part of this event. Thank you, sir.
Our
Thank you
pleasure,
very
sir.
much.
Our pleasure. Thank you so much.
Thank you very much. And lastly, I will request Professor Gustavo to hand over the certificate to Dr. Selective Bagli digitally. Dr. Gustavo. Dr. Selective.
Delighted to do it, Dr. Srilakshmi Bagali. Wonderful to see you again and to see that you have evolved. I enjoyed your questions very much, and it's a great honor to present this certificate for you.
Thank you very much. Thank you. Thank you very much. And
Thank you so much.
Srilakshmi is there. Thank you. So I will send the certificate to all speaker as well as the chairperson by email. And now the last that we have to conclude now, I request once again to Dr. Jyoti Khodnapur, the coordinator of the research club of BLD University, to Dr. Jyoti Khodnapur for vote of thanks. Over to Jyoti.
Thank you, sir.
I think your internet connectivity is not there.
Am I audible, sir?
No, your internet connect. You are audible. Internet connectivity. No, we are not hearing anything. You just speak. Just speak. We'll hear.
Now, sir, I hope.
Yeah.
now I'm
Clear. Go ahead.
Yes.
Thank Dr. Luciana ma'am for accepting our invitation and enlightening about the research. Thank you so much, ma'am, for enlightening us. We are waiting for you for, I request you to visit our BLD University. Thank you once again, ma'am. I thank our chairperson, Dr. Gustavo, sir. He requested to continuously visit our university, sir. And I thank our panelists, Dr. Srilakshmi Bagli ma'am and Dr. Chinmay Shah, sir. Thank you so much, ma'am, sir. And I thank the key person, Dr. Kushal K. Das, sir, for this today's research club meet. And I thank Professor and Head Dr. Shumangala Patil ma'am. And I thank all the participants for today's research club meet, 50th research club meet. Thank you all once again. Thank you so much.
Thank you so much.
Thank you.
Thank you. Bye-bye. Wish you all a very nice day. Thank you very much. So
Thank you very much. It was an honor.
Thank you, Luciane. Wonderful.
Thank you,
to see
Luciane. Thank
Bye-bye.
you, Gustav. Thank you, Chinmay. Thank you, Srilakshmi. And thank you, Lata, Prachi, Jyoti, everyone here. And Dr.
Yes.
Shumangala, the chairman of the department, and all the faculty members. Thanks a lot. See you again. Bye-bye.
Bye.
Bye.